I began the meeting by making this statement, which I think needs to be made to the nation. America's public enemy number one in the United States is drug abuse. In order to fight and defeat this enemy, it is necessary to wage a new all-out offensive.
For 50 years, the war on drugs has raged on throughout the world. Beginning with Nixon in 1971, the crackdown on illicit drugs and their trade has cost billions of dollars, hundreds of thousands of lives, and subsequently changed the fate of millions around the world, especially people of color. To many, the response to the global drug crisis has been nothing short of a catastrophic failure. With the decriminalization and subsequent legalization of various drugs throughout the world, we must reflect on and discuss each country's individual response to the drug crisis, examining the positives and negatives of each one. In this edition of FPTV, we invite you to reflect on the motivations, policies, and effects of different responses to the drug crisis, and how each one compared and contrasted with each other. The study of the drug crisis and its subsequent response is crucial. We must first look and examine our past. Welcome to FPTV. 50 years ago, the world changed. Then President Richard Nixon called out what he referred to as public enemy number one, drug abuse and addiction. He asked Congress to approve an emergency $155 million, citing the urgent need to institute new programs to fight what he called the war on drugs. Ever since then, the war on drugs has spread throughout the world, prompting governments to adopt militaristic, prohibitionist views on drug use. Despite this, the global drug trade has grown tremendously over the past few decades. For example, the global drug trade has grown since 1980, and global addiction rates have still remained an issue even against mounting global pressure. And while we tend to see the issue through an Americentric view most of the time, the global drug crisis's effect on the rest of the world is often understated. To put into perspective, both Asia and Europe's drug rates have dipped, but have remained massive public policy issues since the beginning of the drug war. Countries throughout the past few decades, such as in Latin America, South Asia, and in Europe, have suffered the most from the drug crisis. As we can see, the global militaristic response to the drug crisis has, in total, been a complete disaster. However, each country's individual responses differ to some degree. While some crack down heavily compared to the norm, others instituted much more lenient measures, oftentimes leaning towards more treatment-based methods. When it comes down to the difference between responses, there are no two greater examples than the Philippines and Portugal. On one hand, the Philippines leaned heavily into militaristic rhetoric and policy, implementing harsh, punitive measures. On the other hand, Portugal embraced rehabilitation institutions and decriminalized all drugs. Learning and understanding about the two can help us compare and contrast different countries' responses to the drug crisis and see what worked, what didn't, and how to approach future drug crises in the future. Let's dig in. In 2001, Portugal took a radical step. It became the first country in the world to decriminalize the consumption of all drugs. Drug use, particularly heroin, had permeated through every rung of society, making 1% of the population totally reliant on the drug. Along with that, due to shared needles, Portugal skyrocketed to having one of the highest HIV rates in the EU, posing a massive problem for legislators. However, Portugal felt that decriminalization was the only logical thing they could do, as their attempts at strong policing and enforcement had utterly failed. While they were not the first country to implement such a policy, their experiment has set the stage for the future of drug decriminalization. Specifically, the Portuguese instituted policy was detailed that rather than being arrested, those caught with a personal supply of drugs might be given a warning, a small fine, or told to appear before a local commission, a doctor, a lawyer, and a social worker about treatment, harm reduction, and support services that were available to them. This system allowed doctors, psychologists, and harm reduction experts to take the lead on the drug campaign, although it should be noted, drug dealing was still outlawed. Now then, this might beg the question, what happened to the Portuguese? How did their radical policies work? And even so, how did they maintain such universal support from their population? To answer these questions, all we need to do is look at the numbers. In Portugal, the drug-induced death rate has plummeted to 5 times lower than the EU average and stands at 1/50th of the United States. Its rate of HIV infection has dropped from 104.2 new cases per million to 4.2 cases per million. Along with the drug use has declined overall among the 15 to 24-year-old population, those most at risk of initiating drug use. Along with the quantitative, one must also look at the qualitative to get a better understanding. With the changes in law, Portugal's culture changed to be more tolerating and understanding of drug addicts. One example of this can be seen in the language, as instead of the old world drogados or junkies, drug addicts are now more commonly referred to as those suffering with addiction disorders. It's a victory on the social as well as the political side. When you think of the war on drugs, you might have heard of the hardline policies of the Philippines. The island nation has gained infamy over the past few years, as its policies have taken the drug war to a new extreme. The Philippines' strict policy started in 2016 with the election of far-right politician Rodrigo Duterte. Prior to Duterte's campaign, there was growing fear about the usage of dangerous drugs within the country. Since the 90s, the Philippines has been a global center of the drug trade due to its geographic location, although multiple international reports concluded that the Philippines had a much lower drug abuse rate than the global average. However, Duterte still based his campaign on a complete intolerance for both drug addicts and dealers, urging onlookers at an inauguration, if you know of any addicts, go ahead and kill them yourself, as getting their parents to do it would be too painful. Pretty brutal, right? While his rhetoric has been divisive to say the least, Duterte has taken the initiative in this war on drugs, stirring up more controversy. The police have been tasked with rounding up and arresting anyone suspected of drug dealing or use, and has been given freedom to arrest anyone suspicious without impunity. Another key staple of Duterte's policy has been the frequency of extrajudicial killings. With increased freedom, along with Duterte's hardline rhetoric, the police and members of the public have been given license to kill anyone with ties to drugs at will. Now I might be wondering, with such tough policies, what's the situation in the Philippines right now? Now, while there are many conflicting reports, we can draw a few conclusions from the Philippines' efforts. First, we can see that the number of extrajudicial killings skyrocketed since Duterte took office. Since 2016, over 12,000 people have been killed due to the war on drugs, mostly the urban poor. Along with that, over 3,000 of the deaths have been attributed to the Philippine National Police. In regards to drugs, the price of many drugs have actually become cheaper since mid-2016, prompting speculation that more drugs have come in since the start of the drug war. Drug traffickers continue to use the Philippines as a hub, prompting more anger towards the government's relative ineffectiveness. There's also no data to show how effective the policies have been in reducing the amount of drug addicts, due mostly to social stigma and fear of repercussion. All in all, Duterte's policies have only drawn condemnation from human rights groups and those fighting on the ground in the Philippines. The manner in which both the Philippines and Portugal dealt with the drug crisis are radically different, and the results of their disparate programs show that. While Portugal effectively ended their drug crisis through humane rehabilitation methods, the Philippines have not only stagnated in their war on drugs, but have also committed multiple human rights abuses in the process. Contrasting the two gives us a clear view on which methods work the best and what to avoid in the future. We thank you for joining us today and invite you to explore our channel for more content, as well as subscribing to be up to date with our next projects. For all things youth and foreign policy, check out the FPYC website, where fascinating articles are published weekly. And as always, just do us a favor. Stay young and stay informed.